Anna had a good question for you. It was, how did what you do differ from the role of a standard oncology nurse?
So Ellie and I were talking about this morning, and so I would say, and just my opinion, you go for chemotherapy or immunotherapy, you go to a Dana-Farber, will say, you go there for your appointment, you get your infusion. It might last 4 to 6 hours, maybe 8 hours if you get labs drawn, etc. It's like a procedure that happens in the day.
Mhm.
Have a nurse who meets you, and she'll interact with you during the course of the day, and she'll check for signs and symptoms, and she'll manage you very well, and you're very well cared for. And I imagine that you do develop a bit of a relationship because you're spending so much time together, but she's obviously spending time with other patients as well. For Ellie and I, when we were in the ICU, it really was one nurse, one patient.
Mhm.
So you spent 8, 10, 12 hours, whatever you were scheduled that day, with that patient.
Mhm.
And then, you develop a relationship when they're so vulnerable, and there becomes a little trust. And then they move along their journey, and then you follow them out to wherever they're staying before going home. There's a sense of like ease when you walk through the door, like, hey, I know you, like you've already developed your initial relationship. So, and I think, again, I'm not an oncology nurse, but I think that, she has a job to do. She has to get that infusion in. You have to stay healthy, side effects, check your labs, etc. But we're more of like, if you will, like a holistic approach, right? Like
Mhm.
if he doesn't show up, your wife, like, wonder where Mary is, right? Like, is there something, what I mean? Like, we're more like taking care of everybody, the patient and anybody who they love and care for, because
Yeah.
better if they're better.